Hi everyone. We're going to continue today to talk about the different components that fall under the observation or inspection category for our secondary assessment. We're going to pick up on blood pressure. Okay, so if you go to your slides, um, blood pressure refers to the term that's associated with the amount of pressure that is put on the arteries and the veins when your blood has to go from your heart to all the different parts of your body. Okay, it's kind of like if you're driving on the highway and you can have no traffic and you can zip to wherever you're going, or there's lots of traffic and everything starts to build up and build up. It's kind of how we look at blood pressure. Okay, not to mention it makes your blood pressure go up if you're in traffic. Okay, a couple terms that we'll need to make sure we understand. The first one is systolic pressure. Okay, systolic is going to be referring to the amount of pressure when your heart is actually contracting. Okay, we will see this as the higher number. Okay, it's also going to be the number on the top. Okay, when we have blood pressure readings, you always see something like 120 over 80. This is the 120 would be our systolic. There's more pressure in our arteries when the heart has to pump. Okay, on the opposite side of that, we have diastolic. Okay, diastolic is referring to the pressure in those arteries when your heart is not contracting and it's in that off period. Okay, when it's trying to fill back up. Okay, there's a lot less pressure going on there because it's not pumping, it's refilling. Okay, we also have a term pulse pressure. Okay, and that's just going to be the difference between those two, systolic and diastolic. Okay, so we're going to do a little bit of math, but we just take the top number, which is our systolic, and subtract the bottom number, which is our diastolic, and that's what we get for our pulse pressure. So if we had that 120 over 80, our pulse pressure would be 40. Okay, a little bit more about blood pressure. Okay, a normal reading for a teenager. Okay, you'll see this very differently. Sometimes you'll see 120 over 80. More specifically, though, we like 110 over 65 to 80. Okay, and there's going to be a lot of things that make a difference here. Okay, a couple reasons that we have listed here for why somebody's blood pressure might be higher than that. Okay, if they have a head injury, if they've recently been working out. Okay, so if we have an athlete and we're checking their blood pressure right after they get off the field, I'm going to expect it to be a little bit higher. Okay, medication, and if they're dealing with any illnesses. Okay, but there's tons of things. If they have a family history of high blood pressure, okay, that could just be their genetics. Okay, lack of a good diet, okay, can also raise your blood pressure. Some things for a decrease in blood pressure. Okay, this is where it gets a little bit scarier. Okay, your heart has started to fail. Okay, because if your blood pressure is low, then it's saying that your heart is not pumping the blood out like it should. It's not pushing. It's not pushing with every heartbeat. Okay, it's just kind of doing the best that it can. Okay, then we have shock. Okay, we briefly talked about shock last week. Remember, shock is when your body is starting to shut down. Okay, that would be another reason, as well as medication. All right, we're going to watch this quick little video that just talks about the actual how to take blood pressure. Okay, so here we go.
To obtain a client's blood pressure, choose an appropriate sized cuff. Palpate the radial pulses simultaneously on both arms and choose the stronger pulse rate. Wrap the deflated cuff along the upper part of the client's arm. Make sure that the arm is slightly flexed and at heart level. Locate and palpate the brachial artery before inflating the cuff. Close the valve and inflate the cuff while palpating the radial artery. Inflate to a pressure of 30 units above the level at which radial pulsations are no longer felt. Note this level and deflate. Next, place the bell or diaphragm of the stethoscope over the brachial artery and inflate to a pressure of 30 units above the level at which the radial pulsations are no longer felt. Slowly deflate the cuff and observe the gauge. Listen for the first carotid sound. This is the systolic pressure. Then listen for the last carotid sound. This is the diastolic pressure. Deflate the cuff completely, remove the cuff, and report the client's blood pressure. A normal blood pressure reading is 120 over 80. Hypotension is a systolic pressure of 90 to 100, and hypertension is a systolic pressure above 140, or a diastolic pressure over 90.
Okay, so that just quickly shows about how we check our blood pressure. I'm sure many of you have already had that happen when you go to the doctors. They do have electronic cuffs now that you can put it on, push a button, and it does it for you. Okay, I'm sure all of you, when you are at Walmart, you want to put your arm through the little blood pressure reader. Okay, I know I always did when I was a kid. Okay, but that's how we check blood pressure. Okay, blood pressure can tell us a lot about our body. So the big thing that we talk about in this video, okay, when you put the cuff on and you're increasing the pressure, okay, you use that stethoscope to listen for the sounds of the heart, okay. You slowly let out the pressure and you are waiting until you can hear the heartbeat. All right. And once you start hearing that heartbeat, that's where you get your first number. Okay. And then you keep hearing it, you keep hearing it. And then once you can't hear it anymore, that's where we get our bottom number. Okay. Just kind of keep in mind that that first number is that systolic pressure, that first time we hear the heartbeat. And then once we can't hear it anymore, that is when we get diastolic. Okay. Now on to body temperature. Okay. I know you guys all know 98.6 is our normal body temperature, but something to kind of keep in mind. Everybody is a little bit different. Okay. 98.6 might be your normal, but it might not be my normal. Okay. But it is kind of the median. We use that as our standard number that we want everybody to be around. Okay. It's also important to understand that the core temperature is going to be your most accurate temperature. Okay. If we have the fancy thermometers that rub over your forehead versus the ones that go in your ear, the ones that you put in your mouth, okay, the one that you stick in your armpits, okay, all those are going to change a little bit. Okay, you can have the same person with the same temperature, and depending on where you check the temperature, it might be a little bit different. Okay, a core temperature is going to be the most accurate. Okay, and core temperature is only going to be an internal temperature. Unfortunately, the way we do this is like when you're a baby, there's a thermometer that's placed up your rear end, okay, or just like dogs, okay. It's invasive, but it's also the best way to determine a true internal temperature, okay, because you're not having to fight through the layers of the fat and the skin and the other tissues to get your body temperature, okay. Some things that can increase your body temperature if you're fighting off an infection, okay, there's more activity going on in your body, all right, so it does tend to raise it, as well as heat stroke, okay. Any of our heat related conditions that we'll talk about in the next chapter will cause an increase in temperature. Decreasing body temperature, going into shock, all right, remember we just said shock is everything shutting down, okay, and if we are out in the cold, our body temperature will decrease, okay. We are going to check oral thermometer temperature by placing the thermometer in the mouth underneath the tongue for 3 minutes. Okay. Now, it's important to make sure that you do use a cover available. They do have little plastic sleeves, especially just for germs. All right, but you are going to keep it in your mouth for 3 minutes. Our next category is skin color. Okay, there are 4 basic colors that everybody's skin can turn into or can change to make sure to help indicate what's going on. All right, the first one that we have is cherry red. Okay, it's kind of hard to describe because it's not just the normal I've been working out, my face gets red, or it's very, very red. All right, and that's going to be an indication of heat stroke, all right, which is a very deadly and serious heat related illness, all right, but it can also be an indication of carbon monoxide poisoning. And we're not going to see this very much in sports medicine, but it is something to kind of keep in mind. All right. If you are approaching your victim and you see that red face, it's one of those signs that we're going to look for. If you guys remember jaundice, we talked about jaundice when we were talking about hepatitis, okay, in our bloodborne pathogen chapter. Yellowing of the skin, yellowing of the eyes is an indication for liver condition. Jaundice is what it's called. We talked about, remember, when the babies have jaundice and they have to bake a little bit longer. If you see somebody's face that is turning blue, okay, that is an indication of lack of oxygen. Okay, if somebody is choking and they're not getting enough oxygen, you could absolutely have them turn blue. And then pale, just lack of color, they're washed out. That could be a sign of bad circulation, okay? That could be a sign of shock, all right? But all four of these are going to be indicating that something serious is going on with your victim, okay? Checking our circulation is very important, especially when we're trying to determine what is wrong with a victim. Okay, and there's a quick, easy way that everybody can check. All right, the first one, the way that we do that is called capillary refill. Okay, capillary refill is used very, very quickly. You're going to take your victim's finger, all right, or your finger. We're going to press down, we're going to squeeze, and you're going to see as soon as you let go that the white, your nail has turned white, and it's going to slowly start returning back to the normal color. Okay, now it's going to be hard to do that with painted fingernails. Okay, you can also do it on the skin. All right, you can tell that it turns white and it's slowly starting to come back to normal color. All right, but the fingernails are usually the best. All right, we want it to take about 1 second. All right, it could be a situation where that if it takes a little bit longer, it does mean that there is some type of poor circulation going on. It's important to make sure we kind of keep that in mind. I do want to make sure that you try this in class. We will be practicing on each other. Okay, we're gonna go from there. The last thing that we're gonna talk about today is pupil response. Okay, your pupils are very, very big indicators of what's going on with your victim. Okay, you can see two different pupils here. Both are an indication that something is wrong. Our pupil is designed to allow light in or to shrink and to contract if there's enough light in the environment. Okay, so this one right here you can see is a dilated pupil. It is very, very large, allowing for more light to get in. When we turn off all the lights, this is what's going to happen naturally to our pupils. Okay, a dilated pupil is going to be an indication of a lot of things, all right, like a head injury, okay? And the bottom one here is what we call a constricted pupil. It's very, very small. If we were to go walk outside, this is what our pupil would look like. Take a look at our picture here. You can see that this pupil is what we would consider normal size, and this one is dilated, okay? You cannot make one pupil go bigger than the other. They always work together unless there is a serious problem, okay? It's very, very important to make sure you understand that, because if you see this, it can mean a lot of different things. When a pupil is dilated like this, okay, when light is shined on it, it could be poison. They could have something in their body like medication, all right? Because when you shine light in them, they should automatically shrink, okay? On the opposite side of things, when it is constricted, very, very small, when there is a lot of, when it is dark, all right, that's an indication that of heat stroke or, again, poisoning, okay? What we see here on this victim is one regular size and one dilated, and that's going to be an indication of a head injury, all right? All of these are severe, life-threatening situations that need to get evaluated, all right? Next time we talk, we will be talking about the different positions of the body. Thanks.